The ABTA is pleased to welcome you back to our webinar series. My name is Brigham Mon, Program Manager here at the ABTA. Our webinar today will discuss COVID-19 and brain tumors, protecting the patient. This webinar is sponsored by Novocure. Today's webinar will be given in two parts. We will begin by exploring the guidelines and procedures set by hospitals to protect patients during this pandemic. Next, we will dive into important factors for brain tumor patients and families to keep in mind. Without further ado, I'm delighted to introduce our first speaker for the day. Kristen Hayes is the Director of Clinical Quality at the American Hospital Association. Kristen offers operational leadership for organizational initiatives, specifically on the performance improvement team within the Center for Health Innovation. She is primarily responsible for project execution, with particular emphasis on coaching of both external project participants and internal HAI team staff. She has a master's degree in patient safety leadership, as well as a bachelor's in nursing from the University of Illinois at Chicago. Prior to joining AAH, Kristen worked as a nurse in the neonatal intensive care at Rush University Medical Center. While at this organization, she worked as a bedside nurse and moved into a leadership position as the Assistant Unit Director. Kristen utilizes her previous experience in a bustling Chicago medical center to enrich the patient safety activities at the national level to bring higher quality care to patients across American hospitals. Thank you so much for joining us, Kristen. You may now begin your presentation.
Thanks so much, Brigham. I'm so excited to get to talk to you all today and really grateful for this opportunity. So thanks. And you can move on to the next slide. And okay, thanks. All right, so I'm here today to talk to you about what's being done in hospitals and healthcare systems in order to keep you all safe as well as everyone else that's in the facilities. The time that we find ourselves in today is very confusing. It could be overwhelming and unknown for so many reasons. For each of you, you have your own personal diagnosis that you're managing through that adds an additional layer in this current world that we sit in within this worldwide pandemic. So there's so much chaos and confusing things going on. There's so much information out there. Sometimes it's really hard to understand what to listen to. And additionally, the stress and uncertainty can just make it unbearable at times. So seeking guidance from trusted sources like the American Brain Tumor Association is a great way to get reliable, trusted information for you all to be able to make the best decisions for you. My hope is as I said, I can share some information about what's happening within the hospitals and health systems in order to really make sure that all patients are safe during these challenged COVID times that we're navigating through. Next slide. So a little background, this here on the slide is a common model that guides actions within hospitals. The model comes from James Reason and is used by experts across healthcare to assure that safe patient care is being put into action. The main message that comes out of this model is that multiple actions are put together in order to make sure that care is safe. And the thought process behind it is that not one action covers everything, that there are holes that sit within one action. And so by layering these multiple actions together, you can fill those holes. It's like putting together multiple pieces of Swiss cheese in order to create a protective layer so that the safest care is provided to patients. The picture on the screen does show a number of common actions that I think all of us have become familiar with. Things like wearing a mask, physical distancing, these are all recommended to reduce the risk of COVID. And again, as the model describes for us, putting these all together helps to prevent infections. Not one action necessarily will provide prevention and protection from the virus, but putting them all together is what helps us to stay safe and healthy. Sometimes putting these actions together can seem redundant, and we're going to talk through that as we talk through some of the examples. of things that we see in happening in the hospitals and health systems. Next slide. So let's take a deeper look into some of these actions and changes in our day-to-day life that we've seen. I'll try to offer what is happening, why they're happening, and how they are intended to keep you healthy. So as we discussed, many of these activities happen simultaneously, and they happen all at the same time. And again, they are there for the multi-layers of infection prevention, those Swiss cheese layers, in order to make sure that everyone stays safe. So one of the first common actions that you see is wearing a mask. What happens when you wear a mask is your germs are prevented from coming into contact with the person near you, and then their germs are being prevented from coming near you. The act of wearing masks, as well as using social distancing, that is what helps keep everybody safe. Another action is washing hands. This is such a basic skill that sometimes is so overlooked for its importance. Specifically when we're talking about COVID-19, the way you get sick with COVID-19 is by the virus touching your mucous membranes. And you can find your mucous membranes in your mouth and your nose and your eye. And so washing your hands frequently in order to prevent anything from getting into your mouth or nose, and or during, like right before an activity such as eating, that's a great way to keep yourself safe and free from getting sick. Another action that happens a lot nowadays is temperature checks and symptom screening of people as they move throughout the healthcare facility. It's important to identify someone that might have symptoms, particularly if they're brand new symptoms. Another reason that this is used too is because many of the symptoms of COVID-19 may seem not so severe, particularly at the beginning. Things like a runny nose or a sore throat might not seem like something that you give a whole lot of attention to. And therefore, having someone to ask you those questions if you have those symptoms, it allows those that potentially might have symptoms of COVID-19 to be separated from those that do not. Again, you will see this action happening multiple places within the healthcare facility. And I just wanted to talk through one of the examples of why that redundancy exists. So let's say, for example, you were entering a building and the line for the front door was quite long, and you saw a side door that you were able to enter through. You would then miss that first checkpoint of a symptom checking and temperature checking that's done at the front door. And then you might move to a doctor's office, and there, when you meet the receptionist, that person might do a temperature check and ask you about your symptoms again. So if you were to enter the front door, you're already having this conversation twice and having your temperature checked twice in just a very short period of time. But you could see how if that line was long and you just unintentionally ended up skipping that first checkpoint, that's why that redundancy is created, in order to make sure that sometimes things go the way that we didn't expect them to. And so ultimately it's making sure that everybody is safe again, that multiple layers of infection prevention. And then the last thing to talk about, just a common action and change that you have seen, is there's virtual appointments or the use of telehealth. And this has become much more popular than it was prior to the COVID-19 infections that we're seeing right now. And the reasoning is it's helping to, again, create that social distancing, and then limiting the amount of people that you have in areas that there might be sick patients. One thing to note, though, is to be sure to let your doctor know if you need any special considerations during these virtual visits. For example, you might want to share the link for the virtual visit with a family member or a support person. Letting your doctor know that you're going to be doing that could be helpful, because sometimes platforms are specific that they only allow one individual into the room at a time, and or there has to be specific special links sent to each person that's going to be attending the appointment. So just have that conversation. Don't be afraid to share your preferences or what your wishes are with your doctor, because definitely want to support you with what you need in order to get through these different types of appointments. Particularly having a doctor's appointment in your house isn't something that we're necessarily used to. So having the support that you need is important during that time. And then the last point about all of these actions is the guidance for those multiple layers of infection prevention really do depend on the specific situations of the different organizations. So you will see these different actions potentially done differently at different organizations. So for example, we talked about the symptom checking. A lot of times people have that at multiple places throughout a facility, but other facilities feel that it's safe enough to have it at the one point of interacting with the receptionist, for example. So every organization has looked at where the risks exist and how people normally go through the building and have made those recommendations and the changes as appropriate for their facility. So there's, again, another place where things can be confusing because they look different in different places, but it's because the experts are making those decisions based off the situation that exists for that area. So next slide. So now I'd like to take a step back and just talk about healthcare and hospitals. I really feel like taking a dive into the information that sits behind it can give you a little glimpse to help you understand a bit more of these changes. So healthcare is considered a complex system. And what does that mean? What it means is that there are lots of interrelated parts that go into it, and all of these interrelated parts interact in such a way that the outcomes can be hard to predict. Also, what is an example of a complex system is that when you make one solitary change within those parts, it doesn't always create the change that you're expecting at the outcome point. So many times in complex systems, you have to create change at multiple layers within the system in order to really get to the outcome that you're hoping for. And what this means in healthcare is that there are national things that are happening, things happening within the state, even within communities. Then there's also things that are happening within the organization, and then all of us as individuals interacting in the system. So there has been so many changes that have happened at the national level, at the local level, within organizations, and then as individuals. And I wanted to take some time to talk through all of those different things, because the benefit for all of us is that all of these different changes have ultimately supported, again, that safe patient care and keeping us all safe from COVID. Next slide. So as I talked about that complex system that exists within healthcare, I wanted to talk through some of the examples of specific actions that have happened. Many of these actions are probably things that you all have not seen in your experiences within healthcare. So at the national level, there are multiple national agencies that are working together to assure that information is communicated as quickly and as up-to-date as possible. I've been personally involved greatly with the CDC and supporting the frontline providers with the most up-to-date information. They've done this in various different ways. They've converted existing supports as well as created new programs for healthcare providers and for individuals navigating through the healthcare system. There's been numerous calls and networks that have been intended to give the most up-to-date information. It's been a time of significant collaboration, and even this webinar that we're here today on is an effect or is an example of a national resource, the American Brain Tumor Association, getting together to really make sure that you all are supported with information in order to be able to be connected with the best care. Other changes that we talked about were at the organizational level. And so things that, we talked about some things that you've seen, in regards to the symptom checking and virtual appointments and things like that. But then other things that have been potentially gone unseen for your eyes are things such as assuring that the airflow within the facility is supportive to make sure that infections are not spread. Another piece that's being done within organizations is since there's an increased need for masks and gloves and even gowns, just making sure that the appropriate supplies are available when needed. Again, it's all those different multiple layers that go to support infection prevention. And then the last thing is what we do as individuals. We already talked through many of those examples that you and I all do on a day-to-day basis. But then also just making sure that I say to all of you that not only should you do the things such as wearing masks, washing your hands, things like that, but it's also expected of all of those that interact with you in the hospitals or doctors' offices that you visit. Next slide. So this is one of my most favorite pictures when I'm talking about patient safety and what happens. And we talked about this a little bit, but I just wanted to make sure that you all are aware that there is so much that you see, but then there is also so much that you do not see. You know, again, things that we were talking about recently is individuals wearing gloves, wearing masks, even the new plexiglass partitions that are in front of individuals. Maybe a receptionist may have a piece of plexiglass in front of her. That those are the things that are seen. But there are so many other things that are unseen. And I was actually on a webinar just a week or so ago with one of the CDC experts, and he talked about how all these different actions are being taken by hospitals. They, again, as I talked about earlier, are being determined for the population that's there and making sure that they are applying the guidelines. So it might look different to us as we interact at different facilities, but ultimately there's lots of different actions that are happening in order to make sure that the care is safe for all of us. Next slide. So these last couple slides that I have is the last action that might not necessarily be, you know, changes in our physical environment or things, but it really is that healthcare is a team effort. There is so many individuals that go into making sure that healthcare is safe for you all. Many of the things that we just talked about, even the airflow that we talked about, that's being provided and supported by the engineers that work within the buildings that we visit. And so there's so many individuals that are involved, those that we think of regularly, like the nurses, the techs, the doctors, anyone that we interact with on a day-to-day basis, you know, the ultrasound technician, different people like that. But then there's so many individuals behind, and they have come together in order to really make sure that the care that's provided. So one of the things that I talked about is, you know, it's not a physical activity, but it's the way the teams interact. Hospitals and health systems are trained to create a standard of crisis care, and they have activated this during these times. There are things that have been longstanding within hospitals, patient safety huddles that happen every day, but they've been expanded during this time of crisis. I've heard of a number of hospitals having 2 huddles a day. They've involved individuals from their community in order to make sure that those patients that visit the hospital on a regular basis but aren't admitted at this time, are able to stay at home, are receiving the groceries that they need to. So again, communities, so many different actions have happened at so many different areas, but they've really led to making sure that everyone is as safe as they can be. And the next slide. And on that note of healthcare as a team, I left the most important team player for the end, and that team player is you and your family. Patients and families are a key part of the safety team. You're an expert on you. and what you need. So let your providers know if something changes due to COVID, maybe a job loss, some housing changes, difficulty getting groceries or different resources. And let your provider know if you develop COVID or someone close to you develops COVID, particularly if that individual is helping you to schedule appointments or even be a caregiver for you. The healthcare team is there to help you navigate through unfamiliar reality you find yourself in today. Knowing other changes in your life situation can help them to redirect things for you and offer the supports that you might need. Let us know how we can help you. Having a brain tumor is scary and confusing, but also all of the changes related to COVID can be the same. If something seems strange or confusing to you, also, we need your help if things end up being out of order. So, for example, if you were at a doctor's office and someone wasn't wearing their mask the way they should be, let us know about it. Healthcare workers are human and we can make mistakes, but letting us know about it and making sure that we can do something with our colleagues to support the safest care for you is definitely a part of the safety team that you can play. And that's it. I'm going to hand it over to Dr. Claus now, I believe.
Thank you so much, Kristen, for your insight and advice. I'm delighted to introduce our second speaker for today, Dr. Elizabeth Claus. Dr. Claus is Professor and Director of Medical Research at the Yale University of Public Health, as well as attending neurosurgeon and Director of Stereotactic Radiosurgery within the Department of Neurosurgery at Brigham and Women's Hospital in Boston. Her clinical expertise is in the treatment of glioma, meningioma, and brain metastases. Dr. Claus's research is focused in cancer and genetic epidemiology, with an emphasis on the development of risk models for breast and brain tumors. She has served as the overall principal investigator of the Meningioma Consortium, the Meningioma Genome-Wide Association Study, as well as a co-investigator for the GlioGene, Genes for Glioma, an International Glioma Case Control, GICC project. Her most recent project is the International Low-Grade Glioma Registry, an effort to study factors associated with low-grade glioma risk, evolution, and prognosis. Thank you so much for joining us, Dr. Claus. You may now begin your presentation.
Thank you so much, Ambreen, and thank you to the American Brain Tumor Association for always being so supportive. Next slide, please. Next slide. So these are just my disclosures and support. So I live sort of a dual life. I work within the School of Public Health and the Department of Biostatistics at Yale, and then also work as a clinician at Brigham and Women's Hospital. Next slide. So a little bit of background, and some of the data that I'm presenting here relates more generally to cancer patients overall, but certainly applies to brain tumor patients. And essentially the goal of my talk today is to assure you that if you need treatment for a brain tumor, we can safely provide it for you. So data has looked primarily at cancers overall and found that essentially people with cancer that delay care, on average, we do see an increase in mortality due to treatment delay or delay in actually diagnosis. And so this essentially suggests to us that persons with cancer and with brain tumors in particular, especially those that are malignant and for whom treatment would be expected to increase both survival as well as quality of life, should still consider pursuing treatment during the pandemic. It's not to say that for some groups of individuals we might delay safely treatment, but for those that need treatment, we can manage things safely. The caveat that we do throw out here is that patients should always discuss their specific risks as well as any benefits from treatment in light of any comorbid conditions. So those things that make you more susceptible to doing poorly from COVID are going to be the same regardless of whether you have a brain tumor or not. And so some of those things are going to include advanced age, pulmonary disease, and these we know are associated with increased risk of COVID complications. So that's going to be true whether or not you have a brain tumor or not. And then some of the things that we talk about are going to be varied depending upon what your local community COVID's prevalence rates are. So we know that different states, different communities, things go up and down. What we're able to offer will obviously vary over time based upon those rates. And that's something that your doctor and healthcare providers are going to be very aware of and able to offer you guidance with. Next slide, please. So a common question that I get is that are cancer patients at greater risk of COVID than the general population? And people do talk about, are the risks greater during treatment? Are they high overall? And so obviously, as we know, cancer patients can be at increased risk of illness, particularly from an infection when they're receiving treatment, just because their immune systems can be weakened. And so therefore, time of treatment is important to think about, and how long people have an altered immune function. And there's no set time for any given person or any given treatment. We know that during treatment, the risk can be greater, and how long it takes to return to quote unquote normal for that person is variable. When you look at the literature, the studies report variable time periods, but if you kind of take an average across the different studies, it looks like several months is what the thinking is. Next slide, please. And then another question that people frequently ask is, are cancer patients or brain tumor patients, if they do develop a COVID infection, at greater risk of a poor outcome? So the increase in risk does seem to be very slightly greater than the general population. There's a recent study, and I listed some of the references at the bottom of this slide. One is from the Fred Hutch organization, and they looked at a little over 2,500 patients with COVID and cancer and found that they had a little bit higher risk of a poor outcome than the general population. But I will say that all of these rates are kind of moving targets. And in general, the individuals with cancer that had a higher rate of a poor outcome had these associated conditions. So they were older, they might be in their 80s or 90s. They have other conditions such as pulmonary disease, heart disease. So don't forget that a lot of these things are driven by not the brain tumor itself, but by the coexisting conditions. And so cancer patients with other comorbidities, just like the general population, had greater risk. Next slide, please. So one thing I wanted to make people aware of is there is now this COVID-19 and Cancer Consortium. And there are many institutions across the United States that are participating in it. Essentially, it's where physicians and others, and even the patients themselves, can register themselves if they have both a diagnosis of cancer and of COVID-19. And the effort is to try and see among cancer patients what are the effects, both short and long term, from COVID-19. And I listed, this is a clinical trial that's registered with the National Cancer Institute. So I listed below the website if you were interested in registering, if you did have both a brain tumor and COVID-19. And also if you wanted a little bit more detail on the clinical trial, I listed that below as well. Next slide. Another interesting point that actually has just been identified over the past few weeks in an article in the New England Journal of Medicine is when you have cancer patients that do develop COVID, should they undergo the same isolation procedures, potentially in the hospital or elsewhere, or quarantine? And so it's an interesting article in the sense that the patients that they looked at were actively undergoing treatment, and they were infected with COVID, and it was COVID that was classified as a fairly severe level of COVID. But they found that these patients did shed COVID virus for up to 2 months, so longer than we typically think patients remain infectious or at risk of transmitting disease. So it certainly is a question of whether the isolation should be different, whether quarantine time should be different, as opposed to sort of the 7 or 14 days that we usually talk about for most individuals. Next slide. So is there a risk of hospital or healthcare facility transmission? We can never say that it's zero, but what we do know now, given what we've learned over the past period of time since February, March, is that transmission is relatively rare. And as you saw with the Swiss cheese model that was presented previously, we really have gotten pretty good at making things safe for the patient. And hospitals are really implementing these safety measures. I know that the hospitals that I work with, I've been extremely impressed with their efforts to keep things safe for everybody. The Centers for Disease Control set general guidelines, and as was mentioned, hospitals are very specific based upon their community and their facility as to what they may or may not do. Screening and testing of patients and staff, very important. And the one thing I would say, and I've seen this once or twice, be honest about what your symptoms are when you are screened. You will not be denied care if you have COVID, but it just keeps everything safe for both yourself and the rest of the people in the facility if you're honest. So don't downplay symptoms that you have. It's better to sort of report everything than to think, oh, that's not important, and then enter the facility potentially with a COVID, but not having people be aware that you're at COVID risk. Universal masking. The one thing that I do talk about with patients, so in many healthcare facilities now, everyone has to wear a mask, but there's not universal eye protection required. At the facility that I work at, Brigham Women's Hospital, we as providers and staff are asked to wear eye protection, at least when we're in close approximation with patients. And so it's certainly something, given the eyes are also mucous membrane, for patients to consider as well, particularly if you are in close standing with others, although we don't recommend travel. If you were to travel, if you're at a grocery store where perhaps social distancing is not being followed as might be hoped. So it's certainly something to consider, eye protection as well as universal masking. Obviously, social distancing in all patient areas. Specific things that we do is we now space the appointments out. So we've increased the timing. We see patients a little bit earlier. We go a little bit later in the day. We try to split everybody up in the waiting area and have plexiglass between the different seats. And then also at checkout, you may notice that checkout is a little bit different. Frequently, at least in the past, we would bring you to the checkout area and you would get your next appointment for your MR or to see a physician or whatever it is that you need. And so now frequently what we're doing is just sending you on your way and having you via telephone or computer set up your next appointment. So it's just a way to stop people from gathering together during the checkout time period where you've got, sort of a Grand Central Station scenario and basically reducing that. There's also, and I'll talk a little bit about this, I think this is the hardest part that at least I have appreciated for patients, are limitations on who can come with you into the hospital, be it for a clinic visit or some sort of treatment or even surgery. The limitations have changed and they are likely going to continue to change. So initially visitors were not allowed. Then at least in the states that I work in, the rate of infection became fairly low. So visitors were allowed, although in sort of a limited fashion. So you were generally allowed to have one adult visitor come with you unless you were potentially cognitively limited yourself. Now it's likely going to go back to, with the increase in prevalence, reduction in visitors as well. And also the timing is usually limited. So it's usually set hours, one visitor, And in some instances, no visitors are all allowed. And that's something too. This is where your healthcare team can really help you. Don't be afraid to ask us for help. Raise any concerns that you have about this. We have volunteers to help, and also we understand how scary it is to have a brain tumor and then to have to seek treatment without a family or friend is tough, but we can help you with that. Also, as mentioned, the entry locations usually to facilities are limited. Do try to stick with that. There's always a little temptation to try to sneak into the open door, but it does disrupt sort of the efforts to maintain safety. The locations can sometimes rotate. So one thing I would suggest, both for rules on visitor limitations as well as entry locations, is the afternoon before you're set to come, give a call into your healthcare provider just to check where am I supposed to go, what door is going to be open, where is it best to park, just to kind of have your plan set ahead of time so you don't have to feel anxious or worried about those sorts of things on the day of the visit. And then obviously frequent cleaning, hand washing, usually around all these facilities now. There's lots of hand sanitizer and ways to clean. Next slide. So how do you know if you are one of the folks that can delay treatment? And everything I present here are kind of general considerations. You really do have to work specifically with your team to decide what is best for you. Obviously, considerations include the diagnosis that you have, or if you have not yet been diagnosed, but there's a suspicion. These are things that your healthcare team can help you to decide. Things that are important are whether you have symptoms or not, whether or not advancing treatment is going to be associated with improving your survival or your quality of life. And then also your wishes, what you want to do, what you feel comfortable with has to come into play. And then additionally, what's going on in your community. And that's going to vary over time. At any point in time, some states might have very low prevalence and other states might have very high prevalence. And so that's obviously going to change safety parameters, but also what services and facilities are going to be available. So two examples that I've recently seen, I see quite a few meningioma patients, and I just this past week in clinic, I had more than one, but in particular, I have a patient in her 60s. She has a meningioma, very characteristically diagnosed on her scan, and it is very slowly growing over several years, maybe about a millimeter at a time, asymptomatic, found incidentally. And so she is someone, given the current scenario, that although eventually she is likely to need treatment, be it her selection of surgical intervention or some sort of stereotactic radiosurgery, but it's not something that's emergent or urgent. And so basically what I said to her is, you know, let's regroup in 6 months, get another picture. Obviously, if anything changes, contact us, but let's sort of ride through this period and keep you out of the hospital if we can. On sort of the other side, I have a gentleman in his 30s and presents to the emergency department with new onset seizure. So has never had a seizure before, otherwise very healthy. When he's in the emergency department, gets imaging, and the imaging looks like it's a lesion that's probably a high-grade glioma. So this is something for multiple reasons we would feel needs to be treated. The patient needs to have a diagnosis so it confirms whether or not what we think is happening on the imaging is actually happening. And therefore, to move forward to treatment, because for an individual like this, treatment is associated with higher increase in survival and improved quality of life. So these are the sorts of scenarios that we see. There's going to be a lot that are sort of in between that are less obvious than these two, but that's something where, you know, speak with your doctors and nurses, the rest of your team, and develop a plan. What delay is appropriate, what delay is not appropriate, and, you know, weigh the risks and the benefits. Next slide. So the other thing is speaking with just one team, particularly if it's not a team that you've been working with over the years. It's it's especially in the second case I presented there, that would be a patient who would not have previously been working with neurosurgeons and neuro-oncologists and radiation oncologists, so they may not feel completely sure or comfortable with the information that's given, or basically the plan that's given is a little scary, so they might seek a second opinion. And so we certainly encourage everyone to do that. The majority of insurance will pay for a second opinion. And the one thing about the COVID pandemic is that there's been a huge increase in sort of this telehealth and facilities and insurance companies being willing to allow such options. So seek this out. Hospitals and facilities are now very well set up to offer these sorts of services. Generally, they can be done virtually. You do not need to see people in person. I will say there are 1 or 2 restrictions, and you would have to be aware of that. And this relates to what state you reside in and what state in which the healthcare provider holds their medical license. Some states are allowing a little freedom of movement in terms of where the license exists for the provider, others are not. So you do just have to be aware that that can be an issue, but usually there are ways to work around things. Next slide. So as was mentioned previously, don't be afraid to ask questions. I think that that's the biggest issue for patients, is fear of the unknown, not knowing what the heck is going on inside the building and what's going to happen to you. So the questions that I hear, and I mentioned this one before, who can come with me? It's going to vary depending upon what's happening with COVID in the community that you're being treated in, but try to work with your healthcare provider to make the best option for you. And so if you're not allowed to bring someone, what are the options? So most of these facilities have staff or volunteers, or even your team themselves will meet you and guide you to where you need to go. So don't feel that you're going to be wandering around the building, or, you know, in many of these large cancer centers, these are big buildings, lots of different locations. People will bring you from one location to another. So let's say you have a busy day of you're getting an MR first, and then you have to go see the neuro-oncologist, and you're thinking, how am I going to find where I'm supposed to go? There are folks that will take you there and help you out. And then the other thing, and I can't really reinforce enough, even though it takes a little learning, is using telehealth. So we can conference your family and friends in. If you don't have a device, we can get a device for you or use our own device. So we can certainly offer that support. And I know many times, especially when you're dealing with brain tumors, it's hard to quote unquote hear what the provider is saying. It is always good to have a second person there, just so you have a second set of ears and writing things down. So certainly would encourage that. And there are ways to work around the situation if you don't have a smartphone or an iPad or whatever you might need. Next slide. So other things, and I mentioned this before, it has been confusing for patients to know, well, what door do I go in? Last time I went here, now they're telling me to go here. So I definitely would suggest the day before, call the team to go through all these little details. What door should I go in? Are visitors allowed? Are they not allowed? At our facilities, your visitor has to be put on a quote unquote list. So make sure you do that. And if you have any problems, you know, on the day of, just give your team a call and they can certainly help you smooth things over. Another question I see a lot is, if I don't have a lot of social support, what are the resources for me? So as I mentioned, lean on your healthcare providers. Patient support groups like the American Brain Tumor Association obviously can offer a lot of guidance. Online groups, if you're an online sort of person, they can be extremely helpful, and that's the group that, you know, knows all the gory details and the tips and the tricks. And then also the hospital social workers can help you arrange things. Let's say you don't have a huge family or a huge number of friends that are able to drive you. There are ways in which the social workers can help to arrange for transportation for you. So I work in Massachusetts, and we have something called the ride that the state provides, and they will pick you up at your home and bring you to your appointments. So there are ways in many locations to arrange things. Next slide. You can certainly ask how the cleaning is done. Most of the websites of whatever facility you're going to list that. And as I said, I've been very impressed with not only my own hospital, but with other hospitals that I've had information from. They really are trying to do the best they can. Do you have to wear a mask at all times? Yes, you do. I would suggest, even if you are an inpatient and you are in your room, that you keep your mask on. You never know who's going to be coming in or out, someone bringing meals or cleaning or whatever. I would suggest keeping it on at all times. And that means, and I know this has been a little hard, your mask is on even when you're getting certain treatments. And that includes things like stereotactic radiation or when getting imaging. And not everybody loves the concept of having a mask on and then you have some sort of a frame or a close fitting space. We certainly can help you work through that. We can offer things like headphones and music. We can have the tech chat with you as you're getting your procedure. And then if it comes to it, we certainly, especially with the longer procedures like stereotactic radiation, can offer forms of sedation. Obviously, that's going to assume that you're not transporting yourself in and out to the facility, but that's another option as well. Next slide. So another question, and one of my patients asked me this other day, and actually it was a young woman who was bringing her father in for treatment for a metastatic brain tumor, and she wondered, is it safe to eat at the hospital? So although many hospital cafeterias and restaurants are open, you have to treat, even though it's in a hospital, as you would treat any other dining establishment and abide by whatever the local laws are re-COVID at the time you're there. So if there's no indoor dining, don't do indoor dining. And my suggestion too is just to reduce that sort of worry or any risk of exposure is bring a sandwich or some sort of food with you. And if you're in between appointments, like I said, you have an MR and then you have a little bit of a wait before you see the radiation oncologist or the neuro-oncologist or the surgeon, and find a quiet corner just to take a food break and refresh. And also just make sure that you're allowed to have food before anything that you might be receiving or doing. Next slide. So be proactive. Next slide. So what are some of the things that you can do? As I mentioned, you do have to try and learn about telehealth. It is the wave of the future. It's probably going to change things forever. Try to learn it. I know for some people it's easier said than done. I was seeing a patient the other day and they said, oh, well, Dr. Claus, I don't have audio or video. How are we going to do this? And I thought, well, that may be a little challenging, but let's try to figure this out. You can certainly also, in some instances, still just use the telephone, especially if it is a known patient. But if it's a new patient, obviously it's better for us to be, interacting with you, you seeing us seeing you, getting a feel for things. There's lots of different ways to learn how to do this. Most hospitals have websites to help you do telehealth as well as get into the electronic medical record. There's free videos on YouTube. If you have any teenagers around, they certainly can help. Local libraries also offer instruction, and there's many states and cities that have financial support to either purchase the equipment that you need or to obtain internet access. Next slide. Vaccines, obviously a very current topic. The American Cancer Society as well as CDC recommends that children with brain tumors should continue to receive both their usual care and vaccines according to the usual schedule. We do recommend flu shots for everyone that doesn't have an associated allergy. And as vaccination for COVID-19 comes into play, in general, we recommend it. Now, obviously, you're going to speak with your physician about whether it's a good idea if you're undergoing extensive treatment. And I know that you've probably seen the Pfizer vaccine that's been initially administered to individuals in the United Kingdom over the past week. They did see 1 or 2 severe reactions in individuals with severe food or medicine allergies. So definitely speak with your physician about that. But in general, we're recommending that both the flu and the COVID-19 shots are obtained. Next slide. Travel. basically don't if you can avoid it. The CDC obviously has listed guidelines. It certainly can increase the spread, and so at least for the time being, if you can avoid it, don't. Next slide. Another thing to remember is if you share a car with anyone who does not live in your household, wear a mask. Avoid public transportation if you're able. We know some of you don't have cars and it may be necessary for you to use public transportation to get treatment, but just be careful, limit outings if you can. And then obviously if you're taking public transportation, mask, think about eyewear, social distancing, and hand sanitizer. Next slide. And so this leads us to the holidays. As you know, many groups celebrate holidays in December. You know, and you're hearing on the news that most COVID transmission now seems to be from social gatherings. So just as the CDC recommends, we definitely suggest limiting interactions to members of your household, right? So this may or may not be your family. And you have to sort of think very carefully. It's not worth it over the next month or so, even though if it's hard to not be with family. Hopefully the vaccines are coming, and if we get through the next few months, things will start to get a little better. Next slide. And so the last thing is mention, if you do get COVID, make sure ahead of time you think about what your plan is, that you have groceries, medication, whether you can, if you do work, whether you can work from home, and make sure to immediately let your healthcare know, right? We can help, we can be proactive, we can help mobilize support, especially for individuals who don't have support. In an emergent setting, call 911. Next slide. Okay, so this is just pretty much everything that I've mentioned. Your mission, should you choose to accept: mask, consider eye protection, social distancing, keep your hands clean, avoid travel for now, low-key holiday plan, get your flu shot. Also, don't take on risky activities that may lead to a visit to the emergency department. I know we're all, myself including, taking on a few home improvement tasks, but this is not the time to take the chainsaw and get on the ladder. Do not do this. You don't want to end up in the emergency department. And most importantly, take some time for yourself and ask for help, be from your healthcare provider or whoever you feel can help when you need it. Next slide. So conclusion basically is that if you need treatment for brain tumors, it can be done safely, and don't be afraid to ask questions to get information and reassurance that you need. Next slide. So thank you.
Thank you so much, Dr. Claus. I'll ask Kristen to come back as well. We do have some time for a few questions. As a reminder, if you do have questions that you'd like to ask, please type and submit it using the question box on the control panel on the right-hand side of your screen, and we'll answer as many questions as time allows. So the first question we have here is asking about the vaccine. Is there any idea of a timeline of when patients and families can actually start getting access to the vaccine? We know that healthcare providers and frontline workers will definitely get access first, but is there any idea of when that vaccine might become available for patients?
I think it varies. So I know at 2 of the facilities that I'm at, they're hoping, I think the FDA is actually meeting tomorrow for the final approval, but it's anticipated that approval will be obtained. And the 2 facilities I'm working at, they're hoping to roll out to the first frontline workers on Monday or Tuesday. It will probably be, I think, you know, I know Dr. Fauci was speaking about this the other day, maybe more April or May and June for the general population, and sort of others are in between depending upon their risk category. That's at least I think what people are talking about right now.
Yeah, and I would also add to what Dr. Claus said is if you have questions about when you'll be able to receive the vaccine, I would definitely connect with your doctor because as Dr. Claus said, there's going to be recommendations based off of individuals' risk categories. So different patients will fall into different groups. So your doctor will be able to advise on where you would fall in the rollout.
Great, thank you for that insight. Another question we have is about telehealth. What is available for patients who might not have access or regular access to the internet or a computer? How are they still able to connect with their healthcare providers when they're not able to come into the hospital or the clinic?
So I guess,
so
no, go ahead, Kristen, go ahead.
I was actually going to say that you had mentioned that in your presentation. So you go ahead and jump into that because I think you've got a lot of details to share.
Yeah, so when you're in-house, the hospital or most of the major facilities will actually quote unquote rent you equipment for free. So we have iPads and we will give them to the patients during their stay so they can use them. And then also, I don't know if it's every state, but at least within, I know New York and most of New England, there are state funds and the social workers can help you access them to, if you are in need to try and obtain funds for both the internet service as well as some sort of a device that would help you connect with your providers.
Great, thank you. Another question we have is for newly diagnosed patients. We understand that it's so important for patients and their physicians to build a strong rapport, but in the time of the pandemic, it can be a little more difficult to do that when they're not coming into the clinic in person as much and they're mostly doing phone calls or telehealth visits. What advice can either of you provide for patients who are trying to build a stronger relationship with their new neuro-oncologist or their new healthcare provider as they're dealing with a brain tumor? Dr. Claus, we could start with you, and Kristen, you can share.
I have found, and this has both been, I teach at the Yale School of Public Health and with my patients, that in some ways I've become closer to some of my patients because it's a much more dedicated, you are looking eye to eye with someone. So I have found, I do believe that it's helpful to see the person. I don't love just the telephone call, and I certainly would not advise that to start. But in a way, it's almost a little bit more intimate of a meeting when you have sort of this setting. So I have not found that to be a problem, and you're able to interact more frequently. It's much more easy for me when I am just sitting at my desk to spend a 5 or 10 minute call with someone than it might be to arrange a clinic visit. So in a way, I think there's almost increased access to the healthcare providers. And Kristen, I don't know if you see the same thing or.
Yeah, I have to say, I don't see patients myself, but I work alongside so many physicians that do, and I've heard the exact same thing. They've actually come closer to their patients over this time. And also, I think a number of patients have even said that they feel more open to share with their physician because they are in their home environment. However, that's not true for everyone. I've actually heard from just a couple of people just about the distractions within their own house. I actually heard from a patient, she's a mom of 3 little kids, and it was really hard for her to be present at the doctor's appointment because her kids were outside the room and she was nervous about what they were getting into. And so even just being a little proactive, just to think about what your home environment is. Maybe you might need, a grandparent to come over and watch the kids, or, these times are challenging and hard. So again, talk with your provider, maybe setting up the doctor's appointment during nap time or something like that might be better suited for your life, managing through this home environment as well as seeking care. So there's a lot of different options, but definitely talk through it with your doctor.
And I think the time is more variable too. Like we've done things at later time periods. So, if you have a partner or someone that lives with you and they can come home from work at 5, so then we can talk with you at 6. So there's a lot more flexibility with the timing as well.
Wonderful. It's really reassuring to hear. And I do just want to take this one last question because I think it's very important. We have an attendee here asking what they can do, when they're taking the necessary precautions, they're wearing masks, washing up, taking care of themselves, but the people they live with aren't taking it as seriously. What advice can you share for individuals that are trying to deal with that? Kristen, we'll start with you, and Dr. Claus, please feel free to jump in.
Give you the hard question, Kristen.
Okay. So, I mean, one thing that I would definitely recommend is, this webinar is being recorded. Ask some of your loved ones or the people that you live with to listen to what we talked about today. So then that way, you're not the one that's delivering the challenging information. Just say these are experts that are offering these recommendations. So you can get them the information that they need to hear from individuals that hopefully they might see as an expert in offering that recommendation. And then I think the other thing is just letting them know that it's something that is important to you. That's the only other advice. So I don't know, Dr. Claus, do you have other thoughts?
No, I agree, absolutely.
Wonderful. Well, thank you both so much for your time and insight. That is all the time that we have for questions today. Thank you again for joining us, and thank you to our NovaCure sponsor for your generous support. Aside from our educational webinar series, the ABTA has a variety of programs that help support patients and caregivers throughout their experience. For more information about ABTA's programs, events, and services, visit ABTA's website at abta.org, email us at info@abta.org, or call the ABTA Care Line at 1-800-886-2282.